Some of you may know our mission is to bring epilepsy education to you. And one of the things you asked for was more information on the ketogenic diet. So this next session is going to be great. Dr. Eric Kossoff is going to present the basics on ketogenic diet and answer some of those burning questions. So let's check it out.
Hi, my name is Dr. Eric Kossoff. I am a professor of neurology and pediatrics at Johns Hopkins Hospital here in Baltimore, Maryland. I'd like to welcome all of you to Purple Day. I was asked to give a short lecture updating everybody on the ketogenic diet, and so I'm pleased to do so, and I will share my screen with you now. So welcome. As you can see, I have a purple tie on today for Purple Day. I'm in Baltimore, Maryland. For those of you not as familiar with Baltimore or our sports teams, we love purple here in Baltimore. Purple is the color of the Baltimore Ravens. This is the Johns Hopkins main hospital dome lit up in purple this past January for purple. Awareness and purple pride in the Ravens. They didn't get to the Super Bowl, but hopefully next year. So again, happy Purple Day to everybody here today. Hopefully you're all staying safe. I will talk about the high-fat, low-carb ketogenic diet, and I love to show this when I start my lectures because I think we were ready with our bacon masks maybe several years ago. And hopefully you're all staying safe. And you can eat some of these delicious masks when you're done hearing my lecture. So, I think I always like to start out with a lecture about the ketogenic diet by just sort of putting it in perspective and sort of why do we need a diet therapy? Why do we need to use the ketogenic diet in the first place? Well, I think we know, from a very important study that was published now 21 years ago from Kwan and Brody in the New England Journal of Medicine that, sometimes medications are not the answer. Even with all of our new medications, and I'm going to show you that. This was back 21 years ago, we knew that there was an issue. Okay, 47% will respond becoming seizure-free with the first drug we pick. This is for adults, but it's applicable to children as well. 14% respond to the second medication we pick. But if you have to go to a third medication, a much less chance of response, only 1% becoming seizure-free. And so this study was 21 years ago, and as time went on, there was some criticism, people saying, well, that's great, but we have so many new medications in the last 21 years. I'm sure if this study was done again, it would be completely different, and we'd be having much better response rates. And so they did, and this was actually published 2018. They looked at, in a similar way to a very specific cohort of patients that they were following and said just what exactly happens. And they saw almost identical results. 50% respond to the first drug, 12% respond to the second drug, but still only 1% with that third drug, despite all of the new medications over the last 18 years since the first study was done. And so this is when we start thinking about alternative options, okay? Can we use epilepsy surgery? Can we do neurostimulation like with the vagus nerve stimulator or the RNS, the NeuroPace device? Or, as we're going to talk about now today, do we think about diet therapy or ketogenic diet therapy as we often refer to it? We know that the ketogenic diet works extremely well, and this is 6-month seizure reduction rates in children after being on the ketogenic diet, typically having failed 2, 3, or sometimes many more medications. And so if you look at this pie graph, you can see about a 15% seizure-free rate overall in most studies, much better than that 1% I showed you from the last slide. And overall, probably about a 30-35% chance of ending up either seizure-free or greater than 90% reduction. And in general, about a little more than half, or 55 to 60% of patients will be what we call responders, meaning at least a 50% reduction in their seizures over time. We usually know this relatively quickly. We tell most families give the diet about 3 months. If it's not working in 3 months, we could go longer, but that's a sign that it's probably not going to work. And at least in children, we usually stay on the diet about 2 years, and then sometimes their epilepsy has improved. We can come off the diet, and they can remain at that seizure control level that they had before. There's a lot of information out there, and part of what I'll do today is just show you some slides talking about the myths out there, show you some of the foods that are used on the ketogenic diet. And so, what I'll try to do is sort of answer some of those questions, maybe, query some of the myths that are out there too. And so, a lot of families will see these articles online, they'll see them in the news, and, they often use words like miracle. They really love to highlight the fat and show lots of images of bacon. And, I think this is good. It's good information. I think it gets the word out about the ketogenic diet. Usually it's a story profiling a child who did extremely well. And so, we certainly do use it and like to hear good news and good public relations about the diet. But there's also some bad stuff out there. And these are just really in the last year, some screenshots from some magazines I saw in the supermarket aisle as I was checking out. I always take a quick picture when I get a laugh out of these. And you can see that, you would read this and not know anything about the ketogenic diet and maybe have a perhaps misperception of really what it is, and is it really truly scientific when you see headlines like this out there. There's a lot of also products out there, some of which are actually pretty good, some of which, you have to be careful. They do have hidden carbohydrates. Keto is really a craze right now. There's, as you can see here, keto pancakes, ice cream, birthday cake mixes. And, in general, I think this is a good thing as long as you're careful, especially for young children where being on a restrictive, high fat, low carb diet can be hard. It's nice to have a few of these options out there as long as you're careful. And, you see some of these books, you see some of these magazines, and you just have to, again, really kind of read carefully and know what they are. A lot of families will get information, as you can see on the bottom left, from books, okay? Barnes & Noble, Amazon, and some of these books are really designed more for people trying to lose weight than for epilepsy. And I'll just sort of end this part of my talk with this that I saw back in September, September 2019 on the expressway in Baltimore. And I had to, of course, take a quick picture of it here. It really is sort of popular everywhere right now. And so, what I like to do, as I talk to parents, I talk to patients who are interested, is really make sure that they understand there are three important myths that are, what people sometimes think about the ketogenic diet, but aren't necessarily true as we use it for epilepsy. Number one, there's a myth that this is a therapy that is completely safe and without side effects. There's a thought that this is so different than medications that parents will say, I don't want to do medications, I want to do the diet. And we really sit down and explain to them that, there are risks, there are side effects. And we're going to get into most of what I'll share on this slide later on in my lecture. The second myth that I hear is that it's similar to what they see in books and the internet, as I showed you in the past few slides. And in some ways, the internet and books do have some recipes. They do talk about the general principles of the ketogenic diet. However, you just have to be really careful as you read these books because they are not designed to be as strict as what we do for epilepsy. And patients will sometimes follow what they see in those books, find that it's not working, get discouraged, and say that ketogenic diet is not an option for them or their child when it really may be. And then again, sort of getting back to sort of almost a corollary to the first myth, if they start ketogenic diet, they can then stop all of their medications. There are some select situations in children and adults where we may do the ketogenic diet first. In about 20% of patients, we can get them off of all their medications if they do really well. But the vast majority of patients, 80%, do need to stay on medications. It's a partnership between the anti-seizure medications and the diet therapy. We'll cover some of these today in my lecture, but I think just important to realize that, again, this is a medical treatment done for typically patients with very severe seizures that aren't responding to medication. And just like any medical treatment, there are risks and there are some side effects. It's really an exciting time for those of us in the field. This is the 100-year anniversary of the ketogenic diet. This was the very first article, a screenshot of it from July 27th, 1921. This was almost like a position piece, a hypothesis paper, not even really a true research article, published by Dr. Russell Wilder, who you can see on the left was an endocrinologist, a diabetes expert at Mayo Clinic. And he knew that people were fasting to help suppress seizures. And his idea, as you can see sort of in the red square, was that maybe you could achieve ketosis by doing a high-fat, low-carbohydrate diet instead of prolonged periods of fasting. And so he proposed this as an idea. He wasn't going to do it. He was not a neurologist, but he was the first person to actually poise that sort of question of perhaps let's try a high-fat, low-carb diet for epilepsy. It was popular for many years and then fell out of favor in the 1940 to 1980 period. You can see here the number of ketogenic diet studies published per year, and really around 1994, with the advent of the Charlie Foundation, multi-center research, collaboration, and major pediatric epilepsy centers considering this a treatment that should be used not as a last resort, we saw a real explosion in publications. And now we're having, a paper or two every week getting published about the ketogenic diet. Many of these studies are very well designed. For many years, one of the criticisms of the ketogenic diet was that there were no randomized controlled trials, as there are for medications, proving, so to speak, that the ketogenic diet is effective. That really argument has gone away, both in children and adults, both using the ketogenic diet, and as you can see in some of these screenshots, also the modified Atkins diet. We're kind of past that now. We have really good evidence proving that the ketogenic diet is effective. And so now we're really, I think, answering more interesting questions in the ketogenic diet community, not why, not specifically, I guess, how does it work or exactly does it work, but more into sort of like who can we use it better for. In 2018, we published the revised consensus guideline. The original was published in 2008. The most recent revision, just again 3 years ago, was endorsed by the Charlie Foundation, Matthew's Friends, Child Neurology Society, and the Carson Harris Foundation. And this is a guideline written by neurologists, dietitians from all over the world, giving some guidance for patients, parents, but also neurologists and dietitians who have people on ketogenic diet therapy in terms of what may be the best way to do it. This is really focused on pediatrics, even though there's a little bit of hints on adults. Some adult guidelines have actually just come out this year, in fact. And so I encourage all of you, if you're interested more in really the fine details of how best to do the ketogenic diet, to read this. It's an open access journal, so free. You can just go download this PDF off the internet. We are now also realizing that we can be much more flexible than we thought we could, not even 20 years ago. And so now we have actually 4 and actually a recent 5th ketogenic diet that have come onto the scene. Most of these diets are all relatively similar: high fat, as you can see in the blue, low carbohydrate, as you can see in sort of the yellow, and then a moderate amount of protein in the gray. But the difference between all of these diets tends to be some are done as an outpatient, like the modified Atkins diet and the low glycemic index treatment. Some have really a focus on specific kinds of oils and fats, like the MCT diet, and then some really focus on what type of carbohydrates, low glycemic specifically, are given. So sort of variance on the theme, but it's a nice sort of situation, I think, when we talk to parents, that they can sort of mix and match and decide which diet is most appropriate for their patient. So I'm going to show you a couple images of what these diets look like if maybe you're not as familiar with ketogenic diets. And just, I think, to give you also a perspective compared to what maybe you may have heard of the ketogenic diet from the internet or from watching television. So typically on a classic ketogenic diet, you get meals designed by the gram. So patients will weigh and measure to the gram the foods that they eat on a ketogenic diet. And so typically most foods, most recipes are heavy whipping cream, butter, mayonnaise, or oil to provide that large amount of fat, then a protein, which can be chicken, meat, tofu, shrimp, and then fruit or vegetable to kind of make up the carbohydrates. Usually not rice or bread or pasta. It just won't give you very much if you need to incorporate that in. And so a typical menu for, let's say, for a lunch, for example, would be, as you can see here, 40 grams of heavy whipping cream, 24 grams of chicken breast, 11 grams of broccoli, 21 grams of, again, maybe butter or mayonnaise, followed by 12 grams of lettuce. And so this is sort of what is a typical ketogenic diet meal for a child. designed, calculated, and provided by a dietitian to the family, who will then weigh and measure the foods, and then the child will eat it. This was actually some nice images made by my colleague Stacy Bissoni down at All Children's Hospital in St. Petersburg, just to show you kind of what a 2-to-1 ratio, 3-to-1 ratio, and a 4-to-1 ratio ketogenic diet look like. The ratio is the ratio in grams of fat to carbohydrate and protein combined. And typically we start most children on a 3 or 4-to-1 ratio, but occasionally we'll go to a 2-to-1 ratio. And so you can see here with the 2-to-1, you have maybe a little more apple and a little less of the fat here, whereas 3-to-1, it's gradually, so more eggs, a little bit of fruit, and here it's again chicken, broccoli, a little bit here of some cheese, and then a fair bit of heavy whipping cream, just to show you kind of what it typically looks like as we calculate it out. In addition, probably about a third of our patients are on formula. They're on formula-only ketogenic diets. These are some images that I've collected over the years of various ketogenic products available all over the world, as you can see here. And about a third of our children are infants or gastrostomy tube fed patients. And so you can give a ketogenic formula to those children without much difficulty. And they don't have to have the bacon, eggs, whipping cream, chicken, things like that, because they're on formula. These can also be used as a supplement to an orally feeding child on the ketogenic diet too, as a snack or maybe in between meals. So these are really nice and have come on the scene in the last 20 years as well, and really made it a lot easier, especially for infants, to go on ketogenic diets. And parents and chefs and patients have really been creative. We have lots of cookbooks designed for patients who are on a ketogenic diet for epilepsy, not just for weight loss. You can see here some images that have been taken from some of those cookbooks. To the right is actually Chef Patrick from Canada, who was making ketogenic diet brownies at one of our ketogenic diet conferences. These are some more examples of foods created by parents and patients over the years. And so it really can be very similar to what a child or patient has eaten before they were on the ketogenic diet. It's not as dramatic a lifestyle change as it used to be. These are just some more examples from various meetings and ketogenic diet conferences I've been at. You can see here, some are in other languages. We have German, we have Spanish, and we have Chinese here. Here on the bottom is actually one of our patients being admitted, starting the ketogenic diet and getting food provided by the hospital cafeteria that is weighed and measured carefully for them. At some conferences we've been to that are more low carb conferences designed for people who are doing it for weight loss or diabetes, or the doctors taking care of those patients, you can see some pretty incredible things that are starting to come on the scene. Quest has gotten involved and has some keto foods, some pizzas. You can see here some sandwiches, cinnamon rolls, and then this is actually an Italian company that has made pasta and breadsticks out of ketogenic diet products. The modified Atkins diet was sort of designed to be an outpatient approach, which we sort of monitor carbohydrates, keep them less than 20 grams per day, and then the rest is made up of fats and carbohydrates. And so you can have a little more protein, a little more carbohydrates on this diet, and there's no weighing and measuring involved. And so you can see here a lot of the foods on the modified Atkins diet look like something that you would see maybe in a cookbook or a recipe guide for someone who's, quote, doing keto or doing the Atkins diet out there. On the modified Atkins diet, we usually provide some recipes, some general guidance, but again, for the most part, this is meant to be done by a family or a patient on their own, keeping their carbohydrates relatively low. You can see here, this was actually 15 grams of carbs per day. We usually allow 20 grams nowadays, but this was something we used many years ago, just to give families a general idea of what it would look like on the modified Atkins diet in terms of foods. When children come in for the ketogenic diet, the classic ketogenic diet, most centers still admit them to do the teaching, as you can see on the top right, to gradually introduce the foods, as you can see there in the bottom right and the middle right. It's a process, and so that admission week, as we call it, even though it's generally about 3 days, is really pretty intensive. We go through all about how to do the ketogenic diet and watch the child as they go metabolically into ketosis. At Johns Hopkins, and many centers do things a little differently, what we do is on Monday morning, our children come in at 9 o'clock. We admit children usually in groups of anywhere from 2 to 4 children at a time. In most children, we still do fast, although it's a case-by-case basis, and especially in infants, we no longer fast. But they can have clear liquids through the day. We then at 5 o'clock start half-calorie set ratio, be it again 3-to-1 or 4-to-1 ketogenic diets, starting with dinner that night. We follow their blood sugars. We teach parents how to check ketones. We usually leave their medications the same. We don't make big changes there, and we start lots of the classes. On Tuesday, the parents start checking the ketones themselves, and we've taught them how to do that. We do urine ketones at our center. The classes continue throughout Tuesday. The families learn how to weigh and measure the foods, for example, on Tuesday. And then later in Tuesday, usually around dinner time, we switch over from usually a sort of formula-based milkshake-like ketogenic diet, which they received Monday night, Tuesday morning, Tuesday lunch, to a full-calorie, solid food ketogenic diet, which they can get for dinner. And then Wednesday morning, they often get the breakfast you can see there on the bottom right, followed by more classes. We kind of wrap things up, make sure they have their appointments, prescriptions ready, and usually most children go home around 12 o'clock. And this is what we do at Hopkins. You know, some centers do things a little differently. Some will admit children one at a time. Some will do some of these classes online or sort of abbreviated versions of these classes. And there's no right or wrong way to do it. It's just sort of how we've evolved our program at Hopkins over the years. It's not so bad. You know, one thing we really do tell families is talk to other families. These are some photographs of some of our keto kids, as we call them, who've been on the diet for periods of time. And you can see they're, you know, certainly not upset. She's, you know, liking her bacon and eggs and cheese and some applesauce. Another one of our patients is at an outdoor barbecue, getting her ketogenic diet and diet root beer meals. Maybe looks to me a little better than the hot dog on a bun that her brother is getting. We then follow these kids real closely. So kids are then seen back every 3 to 6 months on average. We usually see them back at 1 month and then 3 and 6. And this is a photograph just taken pretty recently during the pandemic at one of our keto clinics. We see them back with labs, a dietitian involvement, and then as well myself or other neurologists to assess how they're doing. Is the diet doing what we think it should be? Generally, we keep kids on the diet for about 2 years if successful, 3 months if it's not, and then in most children, we then wean them back to their previous foods. And I say this because, you know, on the adult side, if they're doing really well, they're driving, their seizures are really improved, you know, there's no reason necessarily in an adult to just take them off the diet. And so in our adult epilepsy diet center, if it's going very well, patients will stay on the diet way longer than 2 years. In our consensus guideline, we thought maybe the most important table and the message to get across is table 1 to neurologists and pediatricians, which is what are the conditions in which the ketogenic diet is super effective, okay? Remember I showed you that pie graph where about 50% of patients respond. These are actually a list of situations where the diet has been shown in at least 2 centers with really good data that it's at least 70% likely to give you a 50% response. And so some of them are listed here: Angelman syndrome, Dravet syndrome, GLUT1 deficiency. I'm not going to get into sort of all of these here today, but suffice to say, you know, we're really trying to get that message across to parents, pediatricians, neurologists, that if you have a child with maybe one of these conditions who has not responded to 1 or 2 medications, think of the ketogenic diet sooner rather than later, because it's very likely to be helpful. As I mentioned earlier on, one of the myths out there is that the ketogenic diet is all natural and healthier than medications. And I think it's a therapy you have to respect. We all have had children have major issues with it and have had to stop the diet for various reasons. However, I think most of the time the side effects are preventable. And if they do occur, we can make some changes, change the supplements maybe they're taking, and be able to continue the diet. Most of the common side effects tend to be GI related: constipation, reflux, acidosis. Usually you can kind of get through that and keep them on the diet. There are some more sporadic side effects that happen maybe 4 or 5% of the time, like kidney stones, decreased height, dyslipidemia, sort of increased cholesterols, and vitamin D deficiency that we're working on as a keto community. Sometimes these really do cause enough problems that the diet has to be stopped. What we're really, I think, excited about in the field is the recognition that many of our supplements that we're using, and this is table 5 from our consensus guideline, can do a really nice job of preventing lots of these side effects. So many of our children and adults, they're surprised when they come in, they end up leaving on sometimes more medications than when they came in, but those medications tend to be supplements. Multivitamin, minerals, calcium, vitamin D. We use a lot of oral citrates at Johns Hopkins to prevent kidney stones. Laxatives like Miralax can also be super helpful to keep children tolerating the diet well, so that if it's working, they don't have to stop it. One of the questions that comes up quite a bit, and I thought I'd address here today, is again the interaction between our anti-seizure drugs and ketogenic diets. As I mentioned earlier, the vast majority of our children, probably even more adults that are on the ketogenic diet or various ketogenic diet therapies, are also receiving anti-seizure drugs. We might get them on less medication. We might be able to cut some of the medications down, but usually they're on 1 or 2 medications. About 20% of the time, the real super successes, we can get them off of all their medications. We usually do try to prevent them from getting hidden carbohydrates in the liquid preparation. So in many situations, we'll talk to the family about trying tablets or sprinkle capsules, things like that, instead of liquid preparations. And I think it's important to recognize there really is no one drug or multiple drugs that are bad to use with the ketogenic diet, or there aren't really any that are particularly good in combination with the diet. They're all pretty neutral. We do know valproate can lower ketosis. It's been shown. It can also lower your carnitine levels. So you have to be a little bit cautious with valproate. We know topiramate, which is called Topamax, or zonisamide, which is Zonegran, can increase your chance of kidney stones or acidosis. So really important that they're on Citric K while they're on those medications with the ketogenic diet. And then there was one study that was actually pretty well done that said maybe lamotrigine was a negative risk factor for good response to being on the ketogenic diet. I haven't seen that in our population, and I know a lot of centers haven't either, but I think people are interested to say maybe we just don't know yet, are there good combinations with the diet or not. I'll sort of end with a couple highlights of where the field may be heading in the next 20 to 30 years. And I think one thing that has really been a big change in recent years has been a recognition that infants do really well. Not just that they tolerate the diet with the formulas well, which they do, but also that their outcomes are spectacular. And so back about 5 years ago, the Europeans put together their own sort of separate guidelines, but very specifically focused on using the diet for infants, those with infantile spasms. And so, probably nowadays, half of our children that go on the ketogenic diet at Johns Hopkins are under age 2 years. In addition, there's a recognition, as I've hinted about throughout my lecture, but now I'll get into a bit more detail, that the diet can be very effective for adults. And this is not a new idea. It goes back to, as you can see, 1928. And then it took a long time, as you can see here, 71 years before the next major publication came out from the group at Jefferson, looking at the ketogenic diet in a small series of about 20 adults. We now have an adult epilepsy diet center. There are probably about 30 around the world that have come to be in the last few years. We just had the 10-year anniversary of our adult epilepsy diet center this past August. We have seen over 400 adults, although initially we thought this would be very useful for patients that were my pediatric patients who grew up and needed to go to an adult center. Actually, in reality, only 20% of the patients in our center are like that. And now probably more than 80% have never been on a diet before. They're adults. Sometimes they've had pediatric onset epilepsy, but nobody mentioned it to them. And now they're adults, and somebody says, hey, you should maybe think of the ketogenic diet now that you're an adult. This is a photograph on the right of our adult epilepsy diet center. It's run by Dr. Mackenzie Cervenka, along with her partner, Dr. Tanya McDonald, and they do a real great job. There are a lot of interesting unanswered questions in pediatrics, but certainly in adults. How do we improve compliance? We know adults who go on the modified Atkins diet, as we do in our center, it's hard, and they often drop out if there's an issue, or if maybe they're not getting the seizure control that they'd like. And so there's a lot of interest in maybe things like ketone esters, extra MCT, providing set recipes to make it a little bit easier for some who maybe don't know exactly how to do it, and maybe some pre-made foods. A lot of adults are interested in using this before medication. Is that valid? We really don't know yet. Although certainly elevated lipids in children happen, it may be more of an issue. We don't know for sure in adults. And so there's a lot of interest here in maybe should we be using statins? Should we be lowering the ratios? Should we be changing the type of foods that they get? Or should we just not worry about it? Is the diet safe in pregnancy? A very important unanswered question. And then as well, what about the elderly? Some elderly with epilepsy, it's a common thing that can go together, are interested in using diet therapy. Is it safe? There's some potential interest in maybe it helping dementia, Alzheimer's disease, maybe would do both things for you if you're elderly. Unclear. And then lastly, just to kind of highlight where, again, the field may be heading, there's a lot of interest in things other than epilepsy in using ketogenic diets. Many of you probably have heard about cancer, Alzheimer's disease, autism, migraines, but as you can see here, lots of other neurologic conditions just in the last really 20 years that have come onto the scene. And some may be really helpful, some may not be, and I think we're learning as we go. So stay tuned here. If you have more questions about the ketogenic diet, there's some really great websites out there that have excellent information, recipes, sometimes lists of different centers that offer the ketogenic diet. In the United States, I often recommend that families go to the Charlie Foundation website. To the top right is Matthew's Friends, which is run out of England, but also has branches throughout Europe and South Africa. And then finally, the Epilepsy Foundation has some excellent information about the ketogenic diet. I run a blog called Keto News, where every other month I highlight what's new in the field. But there's also, again, just great information and even a few recipes on the Epilepsy Foundation's website. Lastly, we're excited that just last month, in fact, the 7th edition of our Ketogenic Diet Therapies book came out to coincide with the 100-year anniversary of the ketogenic diet. And this is a book really written for parents, caregivers, and patients to give good information out there about what we've talked about today in a lot more detail. And so I encourage you to look for this in your library or on Amazon if you have more questions about the ketogenic diet. This is our Ketogenic Diet Center. I really am indebted to all of them that keep our center running. We have great dietitians, nurses, social workers that really do a great job keeping our patients satisfied, happy, and compliant with the ketogenic diet. And so with that, I will end this lecture. I'm always available by email. If you have questions, certainly you can drop me a line. You can look at my blog on epilepsy.com. And I hope this was helpful for you. Thank you all very much for your kind attention.
That was great. Someone in my family lives with epilepsy, and I can't wait to go back and share some of the insights that I got on the ketogenic diet from Dr. Kossoff.